student statistics on overdose in our area, BOCES criminal justice class. Anyone here from BOCES? When you approach the microphone, please state your name and address if you so desire, but at least your name for the record.
My name is Janessa McLeod.
My name is Corey Parkman.
I'm Jolyn Mulholland. I am the prevention director at CHAD, and I live at 19 Hazelhurst in Owasco.
Thank you.
So this year, the CHAD and the STOP, which is to prevent underage drinking program, worked with our criminal justice students at BOCES to create a youth-led adult-guided survey to collect information on the substance use and mental health status of our youth in Cayuga County. The students came up with the questions, and they actually implemented it in the BOCES programs for grades 11 and 12. And they're just going to provide you some information and stats that they found that our students in Cayuga County are facing and the challenges.
So a couple things that we tried to figure out was, how many people were using and what type of drugs they were using. The grades that we decided to go after were 12th and 11th graders, and we got around 297 people altogether from different schools in the Cayuga area. Some important information that we got was that over 23% of students were using drugs like marijuana, and 8% were using alcohol. And we thought that was, that's like a huge number of people that are under the age that are using these drugs. We also found that a lot of people, 20% said it was somewhat easy to obtain these drugs and alcohol, and 29% said it was very easy, to get these substances. Then we also asked the question of, do you suffer from any mental illnesses? And we found that over 66% of students that answered the survey said that they suffer from anxiety. 46% said they suffer from depression, and over 40% said that they suffer from ADHD and ADD. 16% said they suffer from PTSD, and then 24% said that they suffer from other types of mental illnesses. So we also asked the question of, why do you use the substances? 12% said they use it because of their anxiety. 4% they use it because of their trauma. 6% said they use it because of depression. And then over 16% said they use it for fun, which that's also kind of scary. We also asked, do your parents or guardians know that you are using these substances? Over 26% said yes, that their parents are aware that they're using the substances. 12% said that no, their parents don't know. 10% said they don't know if their parents are using it, or if their parents are aware of their use. So we asked if they wanted to stop using the substances, if they would reach out to get help. Over 57% did say yes, that they would reach out if they needed help, but 32% said that they wouldn't reach out for help if they wanted to stop using substances. So we also asked, do you vape with tobacco or marijuana? 9% said yes, they do use nicotine products like vapes, and 7% said that they do smoke like marijuana with vapes, and over 20% said that they do both. We also asked, do you ever use drugs and alcohol while you're by yourself or alone? 37% said yes, they do, and 62% said no, they do not. We also asked, do you use drugs or alcohol to relax or feel better about yourself? 36% said yes, they do, and 63% said no, they don't. Okay.
Trying to look for those.
We also asked the question along the lines of, have the students ever rode in a car with somebody under the influence? And it was almost half of the students have rode in a vehicle with somebody under the influence. When we started doing a focus group with our students, we found out that our students are actually riding in vehicles with their parents under the influence, which goes hand in hand with what we've been seeing in Cayuga County with our DWI status and our DUI statuses. It's really concerning because how do we teach kids as prevention providers to tell their parents they're not going to get in the vehicle with someone under the influence? We also, 66 kids reported that they had seen an overdose related to substance use. That's a lot of students in Cayuga County that are facing this. Anything you guys want to add to that? No. So these were just concerning things that we wanted to bring to your guys' attention as marijuana and things are becoming more legalized in our community. We're seeing that our kids are facing a lot of challenges post-COVID, and it's concerning. The numbers are very concerning. We have seen that our prevention strategies around prescription drugs have been beneficial. We asked if any of them had taken prescription drugs that were not prescribed to them, and surprisingly 87.41% stated they had not. So the information that we have been putting out there around prevention related to prescription drug use is very key. And then we also asked if they'd be interested in participating in a Narcan training, and 38.44% said they would. So we have students in our school districts who are willing to be first responders, as we know now that fentanyl is in almost everything. We just saw a recent campaign that had kids playing on a playground, and the mother said, "I'm trained in Narcan because my kids play at the playground." As we touched on Earth Day, our kids are being exposed at playgrounds, community locations with substance use, paraphernalia, needles, all different types of things. So we ask that the City Council supports prevention efforts in our community as much as possible. Thank you for your time. Do you guys have anything to add?
Well, question, counselors, anyone? Counselor Genatino, if you don't mind answering a few questions.
Absolutely.
Thank you, Mayor. Ms. McLeod, Mr. Parkman, Ms. Mulholland, thank you for taking the time to be here this evening and for this good work that you've done. I wonder, so the people that were surveyed, they know that they were working with students, obviously.
Yeah.
So I wonder if they were more open to being honest with students than they would be if they were being surveyed by adults.
What was your guys' takes on that? You guys were the ones that went into the classrooms.
So as we went into the classrooms, we did disclose to them that everything that we were getting them, like from the information, was all confidential, and no one would ever see their names. So that was a big part of it, knowing that their names will never be said or out in public.
Okay, good. I guess my question is, what's the next steps with this data? I mean, you gave some alarming statistics, but then some encouraging statistics too, that 67% of these students are willing to engage in maybe some help.
Yeah.
And will this information be shared with some of the local agencies that are tasked with that?
Yeah. Yes, so actually as CHAD, we currently are working with the Cayuga-Onondaga BOCES to create a coaster agreement to implement prevention services in all of the county schools, which currently we only service the rural schools. So this will be a big impact as the city of Auburn houses almost 4,000 students. So that will be a huge impact for us to do. We also have wrote for 4 grants recently, trying to implement prevention strategies. The Youth Bureau just awarded us our money today to do some more prevention strategies, so that was very exciting. But yeah, our status is really concerning. The schools are reaching out constantly. They're in a crisis with our kids, both with mental health and substance use. And we're running into an era of kids who were raised by parents who were in active addiction or are currently in treatment or some form or recovery. So we have a big challenge ahead of us, and COVID didn't really help us that much. So we saw an increase in spike, but yes, we have been sharing that data. We're trying to do as much as we can with it. We do have some positive messaging that we would like to turn some social norm campaigns into. So social norm campaigns, for those who don't know, is spinning a message. So say you could say like 80% of your peers are not using, instead of saying 30% of your peers are using, you would switch the messaging around. So that are things that we are working on and hoping to change the environment and working. We've had reports of kids as young as 5th grade recently who need substance use help.
And in terms of the assistance, I'm glad you touched on the mental health aspect of it too. I think you said there were 66 students who had witnessed
An overdose.
I got to imagine the trauma that goes along with that, the fact that you are focusing on the mental health aspect of it in addition to the addiction aspect of it.
Yes, they go hand in hand.
I know that the City of Auburn, along with Cayuga County, has joined in several lawsuits against pharmaceutical companies. And as those dollars start to roll out, and they are coming out slowly, there are certain amounts that we can spend on these types of prevention efforts. And please know that we are committed to that. I know the county is as well. Hopefully that will provide some relief.
Yeah. One of the big things the kids did talk about in their focus group was that they would really like to see a place that they can make their own here in Cayuga County. So I know as state opioid money comes down or any type of funding comes down, grant funding, please let us know because I'm more than willing to apply for it. Our kids really need a space of their own. Once they get out of that elementary school age, they don't really have a place in Cayuga County or in the city of Auburn to call their own. Our playgrounds are geared towards younger kids. We don't have an older playground like a Ninja Warrior style playground or anything like that. They talk about a hangout place that they would really like. So I think that if you guys grabbed in a focus group of young kids, you could really see what our youth need in this community.
Thank you.
Thank you.